Welcome and thank you for joining part 3 of Seyfarth's micro-webinar series, Half an Hour for Healthcare, Helpful Hints for Healthcare Companies on California Wage and Hour Issues. This session will cover meal breaks, waivers, rest breaks, and regular rate of pay. All participants are in listen-only mode. You are encouraged to submit questions throughout the program using the Q&A feature located on the right side of your WebEx window. We will do our best to get to everyone's questions. However, if your question is not answered, our presenters will follow up with you in the days ahead. For those interested in CLE credit, an attendance verification code will be read during the presentation. Please write this code down. It will not be repeated and is required for CLE credit. Copies of the webinar recording and materials will be distributed to attendees in the days following the presentation. At this time, I'd like to turn the program over to Pam Vardavidian.
Great, thanks, Christian. And thanks everyone for joining us on today's webinar regarding wage and hour issues that are unique to the healthcare industry. As Christian said, this is part 3 of a 3-part series. If you missed parts 1 and 2, you may want to check those out on our website, or I'm happy to send you a link if you reach out to me. Those earlier webinars touched on some other topics that you may be interested in. So let me know if you missed it, and I'm happy to get you connected with those recordings. So today we are going to be talking about meal periods, meal period waivers, on-duty meal periods, rest periods, and the regular rate of pay. And we'll be highlighting, since this is not just a general webinar, we will be highlighting issues that are important to healthcare industry. Go ahead and, oh, you already went through the intros. Sorry, Christian's ahead of me. So I am a partner in the San Francisco office. I specialize in employment law and wage and hour issues, and I will be joined today by Galen, who is a senior associate in our SF office as well, also specializing in employment law, and we both advise healthcare clients on a number of these issues. All right, go on ahead. We went through the agenda. As we said, we'll be spending most of our time today really highlighting the meal periods and meal period waiver issues that come up. We'll talk a little bit about rest breaks, and we'll end with regular rate of pay. And also, as Christian said, we will do our best to answer questions as they come up. This is only 30 minutes, so what we'll do is if there's a question that we're not able to get to, we will reach back out and connect with you. So don't worry about that. We will get to your questions if we're not able to in this 30 minutes. All right, so let's dive right in. I'm going to hand it over to Galen to sort of start us off with a primer on meal periods, and then we'll circle back on how this affects healthcare clients in particular. So go ahead, Galen.
Great. Thank you, Pam. Well, good morning or afternoon, depending on where you're located. So to start off with, as most people know, especially in California, employees are entitled to meal periods. The rules are fairly straightforward at this point in time. However, there are a number of specific nuances that can catch unwary employers up. So the general rule is that an employer must provide a meal period to a non-exempt employee in order to comply with California law. Now, what does it mean to provide that meal period, right? Typically 3 things. You need to relieve the employee of all of their duties and their work obligations during that half-hour time period. The second thing is you need to relinquish control of the employee. They need to be free to walk around, to leave the facility. They can, they're not under the employer's control at that time period. And the third thing is you need to give them the reasonable opportunity to take that that meal period during their shift. However, the Supreme Court in California has held that employers do not need to force the employees to make sure that they don't do any work, right? If an employee wants to do work during this time period, they can, but the supervisor can't encourage them to do work, and they can't pressure them to do work. Fairly recently, there was a lawsuit where a supervisor would regularly come into the break room where an employee was taking their meal period and would just look up at the clock and look at the employee and walk out. They didn't say anything. And the employee felt that the supervisor was pressuring her to take a shorter break, even though the employer never said anything. The supervisor didn't say anything to her. Ultimately, the court found that this was not a violation, but this was a lawsuit. It did go up to the Court of Appeal. So that's, how these types of situations can arise. Can we go to the next slide, please? Ah, perfect. So to dig into this a little bit more detail, employer does not need to allow the employee to take their meal period whenever you want to, right? And you don't need to allow the employee to skip their meal period if they want to. Employers do have the ability to require employees to take their meal period at a specific time. Now, especially in the hospital context, this can be particularly important if you need to schedule when employees are going to be working. You don't want to allow everybody to take their lunch at the same time, because then, patients might not have anybody there for them for a half an hour, which could be a problem. So you can schedule meal periods. That's allowed. You can also require the employees to take a break later if they accidentally work through their meal period. Or you can require the employee to leave their work 30 minutes early if they choose to work through their meal period. So you wouldn't have to pay overtime if they choose to skip their meal period. Now, it's kind of inevitable that there would be kind of individualized circumstances where somebody might skip their meal period and you would owe the penalty. It's a 1 hour of the employee's pay at the regular rate, which we will discuss in detail later. However, the key is to ensure that you don't have any policy violations. In other words, you really want to make sure that you don't have anything that would support a class action lawsuit. That's the most important piece of advice, and that's what we really look for when we're advising employers. All right, and then can we go to the last slide? All right, and then the other thing to really keep in mind is, when do these meal periods need to be provided? Now, California law is very specific on this. In general, and Pam will talk about some specific exemptions that are unique to the healthcare providers later. However, in general, the first meal period must be provided by no later than the end of the 5th hour of work. The second meal period must be provided no later than the end of the 10th hour of work. And you must schedule the meal periods to begin at least 30 minutes before the end of those periods. So it can't end right at the 5 hour, right? You need to make sure that the employee takes their meal period before that 5 hours is up. Now, if you do have an employee working more than 15 hours as well, a third meal period must be provided. That's not super common, but it does come up occasionally in the healthcare industries. All right. I believe that's it for this slide. So I'm going to turn it back to Pam to talk about a few unique issues for healthcare employers with regard to the meal periods.
Great, thanks, Galen. So that was sort of a quick primer on meal period requirements for all industries, but there are special challenges with these requirements, particularly in the healthcare industry, where, as we all know, flexibility is often needed due to the nature of the job of healthcare workers. And unfortunately, we all also are probably familiar that California is not always the most flexible with regards to these requirements. So employers must provide meal periods at the time intervals Galen just explained. It comes up where employers are supposed to get their first meal period before the 5th hour of work. And it's also important that they're not cut short or interrupted. So her first piece of advice is, of course, have clear policies, have good manager trainings on these requirements, and also know when flexibility is allowed in certain circumstances, which we're going to discuss. And you want to keep track of these sorts of agreements that you enter into with employees when they do enter into these flexible agreements with you. Another issue that comes up a lot is being interrupted by things like pagers or calls to their cell phones. If an employee is paged during a meal period and responds to the page, unfortunately, even if it's just a second to say, hey, I'm on my meal period, I mean, that is arguably an interrupted meal period. And unfortunately, then the employer owes a penalty of 1 hour of pay at the regular rate of pay. So this is something that comes up a lot in the healthcare industry because obviously emergencies happen. Other issues, special issues have to deal with the meal period waivers. Since healthcare workers often work longer shifts, it's not always practical to take 2 meal periods in 12 hours, for example. And so we'll talk about the meal period waivers right now next. But the important thing to remember on the meal period waivers is we want to make sure they're enforceable. There are a number of requirements for those meal period waivers to be enforceable. So you really don't want to screw these up and be relying on something that at the end of the day is not going to be enforceable. And then we'll get to on-duty meal periods, which is another big topic for healthcare industry, and also the requirements for those, so those are enforceable. All right, so we'll talk about meal period waivers. Next slide. There are different kinds of meal period waivers, some not specific to the healthcare industry, but generally the requirements are that these waivers must be voluntary, they must be by mutual consent of the employee and employer. That's sort of the bottom line, what we have to have in all of these waivers, but there's more requirements that we'll talk about. It's really important that employers and managers carefully keep track of these waiver election status. Sometimes maybe somebody entered into a waiver and we're not keeping track of it. Well, that's not good. So we want to carefully keep track of that. You should have them in writing. Some of them aren't required to be in writing, but I mean, let's be clear here. Let's have everything in writing so we have documentation of that should things go south at some point. So 2 waivers that are not healthcare specific are the 6-hour waiver. That must be used only if employees work 6 hours or less. The employee in that case can waive the first meal period, the meal that is supposed to be taken within the first 5 hours of work. But if the employee works over 6 hours, that first meal period cannot be waived. So that's a very specific situation. There's also something else that's called the second meal period waiver. If the employee works 12 hours or less and took the first meal period, the employee can waive the second meal period, which is the meal period that has to be taken within the first 10 hours of work. But again, in this situation, the employee must take the first meal period, and again, they can't work over 12 hours, otherwise that won't apply. So this is where we have this special exception for the healthcare industry. And this is the waiver that we often talk about, one of the 2. And that's employees can waive their second meal period for longer than 12-hour shifts. So this is, again, exception to the general rule on waivers. But it's important to note, and this is in the next slide, who it applies to. So again, these are special waivers to the healthcare industry, but it is even somewhat limited from there. So it's not just going to apply to anyone working in a hospital, for example. I know there are a lot of words on this slide, but I just want to be clear who we're talking about when we refer to the healthcare industry. And that includes everything on this first bullet point: hospitals, skilled nursing facilities, intermediate care and residential care facilities, convalescent care institutions, home health agencies, clinics operating 24 hours per day, and clinics performing surgery, urgent care radiology, anesthesiology, pathology, neurology, and dialysis. So that's what we're talking about when we are talking about the healthcare industry. So that's broad enough. But when we're referring to the special waiver that we just discussed, the one that's going to apply to folks working over 12 hours a day, that's only going to apply to certain people at these facilities. And those include employees providing patient care, employees working in a clinical or medical department, including pharmacists dispensing prescriptions in any practice setting. And that also will include employees working primarily or regularly as a member of a patient care delivery team. It also applies to licensed veterinarians, registered veterinary technicians, something else to know. So interestingly, this isn't going to apply to a number of workers. It's not going to apply, for example, to those working in nutritional services, admitting department, the finance department, sterile processing. So these folks cannot utilize these special waivers. Next slide, please. And there are also special requirements that apply to these waivers that you must be aware of that don't apply to the 6 and 12-hour waivers. These waivers are required to be in writing. They absolutely have to be signed by the employee and a company rep. Also, the employer and employee must be able to revoke the waiver at any time by providing written notice. And it's at least 1 day, I believe, of written notice. So again, something else to be aware of, you may think you have a valid waiver, but if you don't have this in writing and the fact that it can be revoked, you may have some issues enforcing this. Of course, they have to be voluntary as well. And so what does all this mean? Next slide. So if a qualified healthcare worker, we just discussed who that would be, if they enter into a valid waiver, then the employee does not need to take the meal period within the first 5 hours of work. Instead, the employee must take one of their 2 meal periods prior to the end of the 10th hour of work. So the biggest benefit for employees and employers is that, unlike other industries where employees must take their first meal period before waiving the second, employees utilizing these special healthcare meal waivers can waive either the first or the second meal break. And it's important that you have a valid waiver like we discussed by following these requirements so you're not on the hook for missed meal break premiums, which can add up quickly. So take a look at your language if you have these. Ensure the waivers do not have language limiting the waiver to the second meal period only. Sometimes we see that. Or to shifts lasting no longer than 12 hours, because in these cases, this is, like I said, the special exception where they do apply to those folks. Okay, so let's move to the next slide. Now, I know this isn't interactive, but I thought it might be nice to just break this up a little bit to ask a question that we will answer for you, but maybe you could think about it in your head. Let's see, so here's a good question. Admitting clerk Doug Ross works 10-hour shifts. He generally likes to take his meal period later in his shift and would like to waive his meal period when he works overtime. Can the hospital offer Ross a meal period waiver, and if so, what kind? Let's think about that. So first, admitting clerk, as we discussed earlier, this isn't going to qualify for the special healthcare, one of the 2 waivers we just discussed. It is somewhat limited. So unfortunately, this individual cannot waive one of the 2 meal periods. The second, think about the next waiver. Okay, is he, yeah, he's working more than 6 hours. So the 6-hour meal period will not work here. What about the 12-hour meal period? Would this apply? And the answer is no, because he didn't take the first meal period in this case. As we discussed, he can only waive his second meal period if he took the first meal period. So unfortunately, we're in a situation where none of the waivers apply. But could we argue, okay, this appears to be a preference. He just likes to take his meal period late in his shift. Can we just let him? We can argue we provided it to him. He just voluntarily chose to take it late. He could have taken it earlier. And this is certainly an argument we make all the time in litigation, but this is risky. It's better to avoid this altogether and require that he take his lunch break timely, which is within the first 5 hours of work in this case. All right, let's do another quick question. This one's a little bit more straightforward. How about a meal break question? Here's one. Nurse Jackie really wants to carry her SpectraLink phone with her when she is taking a lunch break, just in case there is a patient emergency. Should All Saints Hospital allow this? You might want to say, oh, again, voluntary, she wants to, we're not forcing her, but honestly, we just see litigation come up so often that our conservative advice is going to be, no, the hospital really shouldn't allow this. The meal period policy should be clear that employees are relieved of all duties during their meal periods and should not be interrupted. And so they should not be allowed to be paged during the meal period. So we should really try to prevent that if at all possible. Okay, now let's move on real quick to on-duty meal period agreements. And this is different than the waivers, and I think sometimes this gets confused. These are not necessarily specific to the healthcare industry, but they do come up a lot for healthcare workers. Similar to the waivers, there are specific requirements that must be followed for these on-duty meal period agreements to be enforceable. Of course, they have to be voluntary, they have to be signed by the employee, you want to have it in writing. The agreement must expressly state that it can be revoked at any time. So again, you want to be sure that that's in there in the waiver itself. And this is an interesting one. For it to be valid, I'm sorry, no, we're not there yet. But for it to be valid, the nature of the employee's job duties must prevent them from being relieved of duty to take a duty-free meal break. And this, you know, you may be able to argue it one way or the other, but the test of whether the nature of the work prevents an employee from being relieved of all duty is an objective one. An employer and employee may not agree to an on-duty meal period unless, based on objective criteria, any employee would be prevented from being relieved of all duty based on the job duties. So some examples of this, like a sole worker in a coffee kiosk might be an example of this, a sole worker in an all-night convenience store, or a nurse who is staffed in an overnight shift and she's working by herself. Those are just some quick examples of where you may need to think about an on-duty meal period. But this is what I think is sort of interesting. This doesn't mean that the employee can just work the entire meal period and skip the meal period. Again, this is different from a waiver. The employer actually must still designate a 30-minute period where they are relieved as much as possible and can eat a meal. There's somewhat of a recent case on this, and that's something to be aware of, that it doesn't just mean, oh, they're on duty, whatever, you know, they don't need to eat, they can just keep working. You actually have to show that as much as possible you're relieving them from duty so they can eat a meal. So something to keep in mind. Of course, the time must be fully paid though. Okay, we've 9 or 8 minutes left. So Galen, go ahead and talk about rest breaks quickly, and then we'll circle back on our last few slides.
Sounds good. One other thing I wanted to just quickly mention as a potential area that we've seen some concern is with regard to documenting the waivers and agreements, especially if you use staffing agencies. Just make sure that you have a way of communicating that clearly, and that whomever is doing the scheduling has that information about who has signed a waiver and where that information is located. So moving on to rest periods, like meal periods, they must be authorized and permitted for all non-exempt employees in California. It's a shorter, period. Obviously, it's only 10 minutes. And like meal periods, the employer does not need to ensure that the employee actually takes the rest period, but rather the employer must authorize and permit the rest period. So rest periods are considered to be hours worked, so they are paid, and the employees should not clock out for their rest periods. We've seen numerous times that it's generally a bad idea to have employees clock out, or even to enter that they had a rest period on their payroll system. It just causes a lot of problems and uncertainty. And can result in employees not being paid for their rest periods, either inadvertently, which can cause a whole host of problems. So the best practice is to just not have them clock out for their rest periods, even if they would continue to be paid for it. Now, the timing of the rest period must be provided during each 4-hour work period or major fraction thereof, which means more than 2 hours. So in general, the rest period must be provided or authorized and permitted in the middle of each 4-hour work period, insofar as practical, right? It's not absolutely required, but you must be able to demonstrate that you did what you could in order to make sure that those rest periods were provided in the middle of the 4-hour period. Now, some important considerations for the healthcare industry in particular. There is no such thing as an on-duty rest period. So that's one difference, right? Like, the employee must actually be given a 10-minute period where they're not working. They're not expected to work. They're not pressured to work. And another thing that's also unique to the healthcare, certain healthcare settings, is the workers cannot be restricted to their premises. They must be free to come and go as they please during that 10-minute period. Now, most of you have been in hospitals before. Those are large buildings. Sometimes and oftentimes you have employees who are scrubbed up. Oftentimes, especially now, you have COVID checkpoints outside of the building. So you can encounter some issues where an employee has a 10-minute rest period, but it takes them 5 minutes to walk to and from their their break room, or 5 minutes to walk outside, and then another 5 minutes to come inside. Now, we've seen some plaintiffs' lawyers arguing that in those circumstances, the employee was not actually provided with a rest break because they were under the de facto control of the employer and that they could not leave if they chose. So one thing to consider, and this is not required, but it is a conservative, advice that we've given some people in this circumstance, is to authorize a longer rest period to account for the time that it would take an employee to walk to or from their place of rest. The other thing to keep in, the other option is to kind of put into your policies that the break begins when the employee reaches their rest room, their break room, or their rest area, or wherever they're choosing to take their rest period. Now, as with meal breaks, the employee should not be permitted to carry their pager or their company cell phone while they're on their rest break. At the very least, you should have a very clear policy that the employees should not, take or respond to work-related messages during their breaks. Now, obviously, people are going to do what they do, and you're not required to police what people do. But as long as you have a very clear policy, posters help, trainings for supervisors help. Those are the types of things that we look for when we're trying to develop evidence in order to, defend against the types of class actions. And recognizing we're short on time, I'll jump it back to Pam to talk about attestations, and then we can quickly cover regular rate of pay after we get the CLE code.
All right, so next slide. I will run through this one really quickly. This isn't something specific to the healthcare industry, but since we're talking about meal and rest breaks, I thought it was really important to remind everyone that meal and rest break attestations are very helpful in terms of cutting down on potential liability, and we strongly encourage them. What's an attestation? It's the process of having employees confirm the accuracy of their clock in and clock outs and confirm they've been provided with legally compliant meal and rest breaks. It's best to have them daily. It can be difficult sometimes to work these out depending on your payroll company. It's not always easy to reconfigure systems, and sometimes there's limited word counts, but it is worthwhile to explore the options here in terms of attestations. And there's some sample language here that we would recommend if you can, inserting that in your timekeeping system for them to actually acknowledge that they've taken compliant meal and rest breaks. Okay, CLE code. Next slide. The CLE code is SS 4721. That's SS as in Seyfarth Shaw 4721. We've got a couple minutes to talk about regular rate of pay, which is a huge topic. Galen, if you can quickly just go through your slide. I've got about a minute worth of stuff to say at the end, and then we'll finish up.
Perfect. So Pam is right. Regular rate of pay is complicated, it's important, and it deserves a lot more than a minute. So if you have any questions about that, please feel free to reach out. We'd be happy to discuss this in more detail with you at any point. So essentially, the regular rate of pay is what certain types of compensation is tied to. So for example, if an employee misses a meal break or has a short rest break, they are entitled to 1 hour of compensation at their regular rate of pay. This also ties into overtime as well. So what is the regular rate of pay? First of all, the regular rate of pay is not the employee's hourly rate. The regular rate of pay is essentially the total amount of compensation with an asterisk the employee has earned in a particular week divided by the number of hours they have worked in that week, right? This can fluctuate, and determining what should be included and should not be included is very challenging. Pam will get into that more in a second. Now, the key thing to keep in mind here is that if an employee's hourly rate is, for example, $40 an hour, and they get a non-discretionary bonus of $50 in that week. Say they picked up some extra shifts and that entitles them to an automatic bonus. Their regular rate of pay, depending on the specific facts, could be slightly higher than $40 for that week. So if they missed a meal break, they're entitled to 1 hour of regular rate of pay. Now, that's not $40 an hour. It is very common for payroll systems to just pay $40 an hour. However, that is a technical violation of the California Labor Code because they're entitled to slightly more than $40. Now, that type of unpaid wage, it could be 2 cents per employee, but if you have 1,000 employees and this happens every other week over the course of a year, we're talking about a significant amount of penalties that can add up over something that is, a relatively systematic type violation, which often results in a class action. These are the types of things that we really try to help employers avoid. So to Pam to talk a little bit about what is and is not included in regular rate of pay.
All right, and I apologize for going over. We will quickly finish this just for those that may want to finish the rest of this on the recording. If you have to leave, I understand. So this is not an exhaustive list, but there are some tricky issues that come up in the healthcare industry because of the different forms of pay that healthcare employers are dealing with. There's differentials. I don't have to tell you. You all know the on-call pay, standby pay, et cetera. This all must be included in the compensation piece. So we just wanted to flag this to remind you to be sure you're incorporating all of this compensation in your overall total compensation used to determine the regular rate of pay. If you don't include all these various elements of pay, for example, a big one is on-call pay, you could be significantly underpaying your employees. And in terms of the denominator number, the hours used to determine the regular rate of pay, we also want to be sure to note that you're including time for trainings and education, reporting time, pay hours, and controlled standby time. As a quick note, uncontrolled standby time is not included in hours worked, but if you actually pay employees for the uncontrolled standby time, which some employers choose to do, that amount must be included in the total compensation. Standby time can be kind of tricky. On-call pay, that was covered in session 2 of this webinar series. So I apologize for going a couple of minutes over. We thank you all for coming. Reach out with questions and have a great rest of your day.